Okay, so good evening, everyone. Can you hear me? Give me a thumbs up or write something in the chat box if I'm loud and clear. So let me know if you can hear me. Please message in the chat box if I'm loud and clear. Okay, great. I'll be flashing my slides in a minute. So just let me know if everything is clear from your end before we start our coaching session. I'm not using any microphone, so this is just my built-in Sennheiser here in my larynx. Okay, great. We'll start in about a minute. I hope everyone is doing fine. Let me know where you're watching from. Are you from Cebu, other parts of the Visayas, Mindanao, Luzon? Taga saan kayo? I see some new viewers, so welcome to the Med Guru. Okay, South Cotabato. Greetings. Laguna, wow. CDO, Cebu, B. Rodriguez. Oh yeah, Emter4, this sounds very familiar. Labangon. Arlington Pond, Peace Valley. Okay. Manila, greetings, magandang gabi. Davao, welcome. Talisay. Long time no see. Oh, who's on board? Pangasinan, wow. Butuan. Okay, great. So we'll start in about a minute. We have a very nice session for this evening. You will be able to review this. Maya Pabenge. Okay, great. So let me just share my screen. And before I start anything, I'll double check if everyone can see the slides. Okay, there. Can you give me a thumbs up or a message in the chat box if you can see the slides? Let me know if you can see the slides. So before I start, thumbs up, message in the chat box if you can see the slides. So audio is loud and clear. How about the slides? Let me know if you can see the slides. Then I'm going to move the slide, just one slide, just to double check it's moving. Okay, how about that? Are the slides moving? Before we go official. So give me a go signal if you can, if you saw the slides move. Okay, can you comment in the chat box? Okay, great. So let's begin. So a pleasant day, dear viewers. Welcome to the MedGuru CDB channel, and welcome to our Biochemistry Blitz coaching. I'm the MedGuru. This is Doc Toon. Greetings from Cebu. Let's start our session. Now, for this quick coaching session, we're going to go over the must-know pearls about the vitamins and the minerals, and a couple of must-know concepts, terminologies, formulas about basic nutrition. So let's start the ball rolling. Now, the first thing we have to know is the two types of vitamins. Now, we have two types of vitamins. We have the water-soluble vitamins, and we have the fat-soluble vitamins. The water-soluble vitamins is vitamin B, that's B complex, and vitamin C. The fat-soluble vitamins, this is vitamin A, D, E, and K, which we commonly call ADEC. Now, let's summarize the must-know pearls about vitamin A. Now, vitamin A is also known as retinol. It's provitamin, which is beta-carotene, as well as retinoic acid. So vitamin A is known as retinol, beta-carotene, and retinoic acid. Now, vitamin A belongs to a group of substances, which we call the carotenoids. Now, one of the most important pearls to know about vitamin A is that it is part or a constituent of the visual pigment that we call rhodopsin. So you would see vitamin A in the visual pigments. Now, vitamin A also plays a very important role in cell differentiation. Now, vitamin A deficiency usually presents with visual problems. Now, question, please type in the chat box, what is the earliest manifestation of vitamin A deficiency? What is the earliest manifestation of vitamin A deficiency? What is the earliest manifestation of vitamin A deficiency? Now, the earliest manifestation of vitamin A deficiency is nyctalopia, or what we call night blindness. Now, other clinical manifestations or diseases that arises from vitamin A deficiency would include keratomalacia, xerophthalmia, and keratinization of the skin. Now, if you were to take an exam, I would strongly recommend the visual pigments, particularly rhodopsin, and nyctalopia, or night blindness, which is the earliest manifestation of vitamin A deficiency. Now, here is a photo of keratomalacia. You now have the involvement of the cornea. Now, vitamin A is a fat-soluble vitamin. So always remember, the fat-soluble vitamins are the ones that are stored. They are not easily excreted from the body. Therefore, fat-soluble vitamins, considering the fact that they are stored, this poses the risk of hypervitaminosis, or what we call toxicity. A toxicity arising from elevated levels of these vitamins. And vitamin A deficiency would usually present with neurologic manifestations, such as increased intracranial pressure and headaches. And this is usually manifested as either pseudotumor cerebri or cranial nerve palsies. Now, there's a magic number for vitamin A toxicity, and that is chronic vitamin A supplementation for more than 100,000 units per day. This is associated with toxicity, and it usually presents either as pseudotumor cerebri and cranial nerve palsies. Now, would you like a copy of the presentation, the slides? Just type in the chat box if you want a copy. Okay, let's see if I can give you a link immediately after this session. The session's not too long. It's straight to the point. If you're interested in a copy of the slides, just type in the chat box if you would like a copy. Okay. Are you guys still there? Is there anyone who wants a copy? I can give a copy. Just type in the chat box. Okay, so just type in the chat box if you want a copy of the slides. Okay, great. Now, take note of these two manifestations of hypervitaminosis A, that's pseudotumor cerebri, and cranial nerve palsies. Now, let's go to the next vitamin, vitamin D, or calciferol. Now, I want everyone to remember, from a biochemistry point of view, there are actually two forms of vitamin D. We have vitamin D2 and vitamin D3. Now, D2 is also known as ergocalciferol. This is of vegetable origin. D3 This is cholecalciferol. This is of animal origin. Now, always remember, vitamin D actually requires sunlight. So we have 7-dehydrocholesterol, and it utilizes ultraviolet light to convert it to calciferol. This calciferol has to be activated in the kidneys, and it becomes the active form of vitamin D. Now, would anyone happen to know the complete name of the active form of vitamin D? So this is known as 1,25-dihydroxycholecalciferol, which we commonly call as calcitriol. That is vitamin D3. That is the active form of vitamin D. Okay, so 1,25-dihydroxycholecalciferol. Now, don't forget calcitriol. This is what you have to bring with you to your respective examinations. 1,25-dihydroxycholecalciferol. This is also known as calcitriol. This is the active vitamin D. This is D3. This is synthesized in the kidneys. Now, vitamin D plays a very important role in calcium, phosphate, as well as bone metabolism. Always remember that calcium and phosphate metabolism is counter-regulatory. So they go in opposite directions, but they supplement each other. So whenever you hear vitamin D, think of calcium, think of phosphate metabolism, and think of the bone. Now, two very important conditions every standard student must bring with them. Every standard clinician must bring with them to the bedside and to the examinations. We have rickets and we have osteomalacia. Now, in rickets, this is actually because of poor mineralization of the bone. In osteomalacia, this results from bone demineralization. Rickets is commonly seen in children, while osteomalacia is commonly seen in adults. So here we have some photos. We have here the bow legs, knock knees. You can also have softening of the skull, okay? Delayed closure of the fontanelles. So here in children, they develop rickets. This is secondary to the poor absorption of calcium. In adults, they develop osteomalacia. This results from the demineralization of the bone. Now, I would like to remind everyone that adults are malicious, okay, not children. Children are innocent. So adults are malicious. Malicious sounds like Malaysia. So osteomalacia is seen in adults. Now, take note of this. This is found in our biochemistry textbook, that vitamin D, although it is not an antioxidant, it is protective against cancers, particularly prostate and colorectal carcinoma. Now, colorectal carcinoma, memorize in your biochemistry books that aspirin is also protective for colorectal carcinoma. Vitamin D is very efficient for pre-diabetes as well as metabolic syndrome. Now, this is not yet in your textbooks, but COVID-19, mild, moderate, and severe COVID-19, we usually give 1,000 to 3,000 international units per day of vitamin D3. Now, question, what are the 3 antioxidant vitamins? What are the 3 antioxidant vitamins? Okay, what are the 3 antioxidant vitamins? Can you type the antioxidant vitamins? There are 3. Tatlo yan. So what are the 3 antioxidant vitamins? So the first antioxidant vitamin is A, second is C, third is E. So very easy mnemonics to memorize. ACE, okay? A, C, and E. These are the three antioxidant vitamins. There is only one antioxidant vitamin, which is water soluble, and that is vitamin C. Now, let's move to the pearls of vitamin E. So vitamin E is composed of two compounds. First is tocopherols. Second is the tocotrienols. So input, tocopherol, and tocotrienols. Now, of the two compounds, always remember the D-alpha tocopherol is the most active form of vitamin D. Again, the most active form of vitamin E, sorry, it's vitamin E, not D. The most active form of vitamin E is the D-alpha tocopherol. So D-alpha tocopherol. Now, as mentioned earlier, we have two compounds for vitamin E, the tocopherols and the tocotrienols. D-alpha tocopherol is the most active form of vitamin E. Vitamin E is an antioxidant because it prevents the peroxidation of the polyunsaturated fatty acids. Now, two very important functions of vitamin E. Aside from being an antioxidant, vitamin E plays a very important role in cell signaling, particularly in the cell membrane. And vitamin E is synergistic with a mineral known as selenium. Why is this important? Because selenium is required as a cofactor for the enzyme glutathione reductase. Now, would anyone happen to remember in what biochemical pathway would you encounter glutathione reductase? In what biochemical pathway would you encounter glutathione reductase? Is it the Krebs cycle? Is it the pentose phosphate pathway? Is it gluconeogenesis? Or is it glycolysis? In what important biochemical pathway would you encounter glutathione reductase? In what important pathway? So glutathione reductase, you encounter this in the pentose phosphate pathway, which we also call the hexose monophosphate shunt. Always remember the rate-limiting enzyme of the pentose phosphate pathway is glucose 6-phosphate dehydrogenase. Now, glucose 6-phosphate dehydrogenase requires the reduced form of glutathione because glutathione protects, okay, it protects the RBC from oxidative stress. Therefore, glutathione deficiency, glucose phosphate dehydrogenase deficiency, this leads to hemolytic anemia. So please remember that. Now, in addition, so let's fuse the major biochemical textbooks. What are the other manifestations or clinical correlates of vitamin E deficiency? So one, this is associated with resorption of fetuses. This is also associated with testicular atrophy. So I always joke that vitamin E deficiency, maliit or gamay ang etlog because it's vitamin E, okay? There is testicular atrophy. Vitamin E deficiency is also associated with severe fat malabsorption, as well as cystic fibrosis, chronic liver disease, nerve and muscle damage, because this plays a very important role in cell signaling. And this is also associated with hemolytic anemia because of selenium, because of glutathione reductase, the synergism. So please take note of this. Now, the next vitamin is vitamin K. Now, vitamin K, we usually get this from green leafy vegetables. Now, in our biochemistry Bible, vitamin K is also known as the anti-hemorrhagic factor or the coagulation factor. Now, tip, vitamin K plays a very, very important role in the clotting mechanism. Now, can anyone tell me what are the 4 vitamin K dependent clotting factors? Okay, what are the 4 vitamin K dependent clotting factors? Okay, type it in. What are the vitamin K dependent clotting factors? Okay, some of you probably know 1972 or 2 plus 7 equals 9. What follows is 10. So 2, 7, 9, and 10. So do not even attempt to enter a testing site if you do not know the vitamin K dependent clotting factors, 2, 7, 9, and 10. So what is the clinical correlate? Vitamin K deficiency, or people who take drugs that inhibits or antagonizes vitamin K, would be deficient in these 4 clotting factors, 2, 7, 9, and 10. Now, vitamin K biochemically exists in 3 forms. We have phyloquinone, menaquinone, and we have menadione. Phyloquinone, menaquinone, and menadione. Now, let me teach you a secret. Letter P, letter P, because it is plants. Phyloquinone comes from plants. Next is menadione, D, letter D, because this is from drugs. Synthetic form of vitamin K, such as the drugs that we inject, that is menadione. Then, of course, we have vitamin K in the form of menaquinone, which arises from bacterial synthesis. So colonic bacteria can synthesize vitamin K. So one last run before you head to your exams. What are the 3 forms of vitamin K? Phyloquinone, phylo, plants. Menadione, drugs. This is the synthetic form. And menaquinone, which is from bacterial synthesis. So who gets vitamin K deficiency? People have low intake of green leafy vegetables. People who have liver disease or colonic disease, or premature infants whose fetal liver is still immature, or whose colonic bacteria, the normal flora, is not yet fully developed, and those who take drugs that antagonize vitamin K. They are the people who will develop vitamin K deficiency. Now, let's talk biochemistry. Vitamin K is a very important coenzyme in the formation of gamma carboxyglutamate. So in the vitamin K dependent clotting factors, gamma decarboxylation is the actual biochemical process that occurs. So vitamin K, first function, it's a coenzyme in the formation of gamma carboxyglutamate. Vitamin K plays a very important role in blood clotting. Then we mentioned the vitamin K dependent clotting factors. And take note, the drug mentioned in our book, warfarin, which is known as comedine, and dicumarol, which we find in rat poison. Okay, so what happens when you give warfarin? It antagonizes vitamin K. It would inhibit the gamma carboxylation of the vitamin K dependent clotting factors. So toxicity, warfarin toxicity, the antidote is vitamin K or fresh frozen plasma, because the FFP or the fresh frozen plasma has the vitamin K dependent clotting factors. Now, what about vitamin B complex? First is vitamin B1. This is thiamine. Dude, it's not a biochemistry exam unless thiamine comes out. Thiamine is a coenzyme of pyruvate and alpha ketoglutarate dehydrogenase. Thiamine is also a coenzyme of trans-ketolase. So please take note of that. Again, please take note of that. Now, of these three enzymes, where thiamine is a coenzyme, pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and trans-ketolase. I put all my money on trans-ketolase because trans-ketolase is actually the only enzyme that contains thiamine. Now, another function of vitamin B1 or thiamine is the regulation of the chloride channel in the process of nerve conduction. Now, these are the clinical pearls you bring with you. First, there's pyruvate dehydrogenase, which is one of your enzymes involved in carbohydrate metabolism. This requires thiamine as a coenzyme. Then we have alpha ketoglutarate dehydrogenase, which we encounter in the citric acid cycle. Then, of course, we have the branched-chain keto acid dehydrogenase, which is required for the synthesis of the branched-chain amino acids, particularly leucine, isoleucine, and valine. So always remember the branched-chain amino acids. Live, L-I-V. We branch out to others so that they may live. Now, if there is a deficiency in the branched-chain keto acid dehydrogenase, what famous disease arises? What is the famous disease which is a deficiency in the branched-chain amino acids, particularly leucine, isoleucine, and valine? Don't forget the urine of this patient. The urine of this patient smells like caramel, or the giveaway, it smells like maple syrup. So this is maple syrup urine disease. Now, the last of the enzymes you have to bring with you is the trans-ketolase, which plays a very important role in the pentose phosphate pathway. Don't forget, the pentose phosphate pathway is an alternate pathway for glucose production. So pentose phosphate pathway produces NADPH or NADH. Okay, this also produces the nucleic acids, okay, the backbone for nucleic acid synthesis. And this also allows the interconversion of the sugars, hexose, pentoses. Okay, so don't forget the functions of the pentose phosphate pathway. Now, 4 conditions associated with vitamin B1 deficiency. First is peripheral nerve damage. Second is Wernicke-Korsakoff syndrome, wherein chronic alcoholics develop confusion, confabulation, they develop ataxia. There is an attack, a demyelination that occurs, particularly of the mammillary bodies. So in Wernicke-Korsakoff syndrome, the mammillary bodies are affected. Now, I have a story. When someone gets super duper drunk, everyone looks like a hot mama. Okay, when someone gets super duper drunk, like everyone looks like a hot mama. Mama, drunk, alcoholic, mammillary body. Okay. And another sign that you're drunk would be, of course, you speak in foreign languages. The English comes out. Okay. Now, alcoholics are also predisposed to thiamine deficiency. It's also stated in our mother book that polished rice eaters, polished rice means the outer covering of rice is removed. The outer covering of rice is very rich. The outer shell of rice is very rich in thiamine. Raw fish eaters, because there's an enzyme known as thiaminase. There's an enzyme known as thiaminase, which is found in raw fish. So those who ingest raw fish are also prone to thiamine deficiency. Now, please remember this visual mnemonics. Thiamine deficiency is associated, okay, B1, that's B1 deficiency, is associated with beriberi. Now, I believe the book mentions dry beriberi and wet beriberi. Don't forget, wet beriberi is the one that presents with congestive heart failure symptoms. Then this dude over here, like a hangover after exams, my monthlies, finals, or the PLE, or whatever licensure exam, this dude is an alcoholic. Don't forget, thiamine deficiency is associated with alcoholics. Now, next is vitamin B2, which we call riboflavin. Now, B2 or riboflavin functions as a coenzyme in oxidation reduction reactions. So this would involve FAD and FMN, flavin adenine dinucleotide and flavin mononucleotide. So don't forget, B2 and B3, which is riboflavin and niacin, they play a role in oxidation reduction reactions. Now, keyword for vitamin B2, deficiency is associated with seborrheic dermatitis. Very specific, seborrheic. B3 deficiency is dermatitis. It is associated with a photosensitive dermatitis, not seborrheic dermatitis. B2 also presents with oral lesions because there are two lips. B2, two lips. So you usually see the lesions around the two lips. You have cracks at the corner of the mouth. Okay. You have fissures there. Then there's also lesions involving the lips. So there's angular stomatitis. Okay. So here's a photo. Here's the cracks, side of the mouth. They can also present with a magenta tongue. Okay. Now, next is vitamin B3, which we commonly know as niacin. Now, niacin can also be in the form of nicotinic acid or nicotinamide. Vitamin B3 also plays a very important role as a coenzyme in oxidation reduction reactions. So we have NAD and NADP, nicotinamide adenine dinucleotide, and nicotinamide adenine diphosphate. The reduced form would be NADPH. Now, B3, niacin, plays a very important role in the regulation of intracellular calcium, as well as cell signaling. So this is just like vitamin E. It plays a role in cell signaling. Now, this is what you bring with you to your exams. Pellagra. This is the condition that arises from vitamin B3 deficiency. This is specifically described in Harper's Biochemistry as a photosensitive dermatitis. Photosensitive dermatitis, as well as a depressive psychosis. Now, can anyone type in the chat box, what are the 4 Ds of pellagra? Okay, what are the 4 Ds of pellagra? First, this is the obvious one, there is dermatitis. Okay, what are the other D's of pellagra? We have dementia, dermatitis, there is dementia, there is also diarrhea. The diarrhea is actually because of excess of 5-hydroxytryptamine or serotonin. And of course, the fourth is death. These are the 4 Ds of pellagra: dermatitis, dementia, diarrhea, and death. So please take note of this. Now, memorize this. Niacin comes from the precursor amino acid tryptophan. There is a magic number, 60:1. What does that mean? 60 milligrams of tryptophan is equivalent to 1 milligram of dietary niacin. So tryptophan deficiency or diseases associated with defects in tryptophan transport are associated with niacin deficiency. So here's the dermatitis. Okay, this dermatitis encircles the neck. Would anyone happen to know the specific name of the dermatitis that encircles the neck? So here, this is the hands, and we have a specific dermatitis that encircles the neck. This is known as Casal's necklace. Okay, we call this Casal's necklace. So please take note of this, Casal's necklace. Now, defects in tryptophan metabolism. There are 2. This is also associated with pellagra. First is Hartnupp's disease. Then we have Carcinoid syndrome. So in Carcinoid syndrome, this is usually a metastasis of a primary liver tumor that involves the enterochromaffin cells. This is from a biochemistry point of view, but from a pathology and medicine point of view, you have to take note. Most of your enterochromaffin cells, this produces 5-hydroxytryptamine or serotonin. You have to remember, they are usually found in the appendix or the small intestines. Okay, if you read your patho books, your surgery books, your medicine books, small intestines and the appendix. That's where you usually see carcinoid tumors. Now, Hartnupp's disease arises from a defect in the transport of tryptophan. So I like to remind students, tryptophan is TRP. Now, pronounce this, TRP, trip. Okay, Hartnupp is tryptophan. Hartnupp is tryptophan. It is tryptophan or tryptophan deficiency. Now, next is vitamin B5. This is pantothenic acid. Pantothenic acid plays a very important role because it is a functional part of CoA, as well as it serves as an acyl carrier protein. It serves as an acyl carrier protein. Now, pantothenic acid plays a very important role in fatty acid synthesis. If there is pantothenic deficiency, this is associated with peripheral nerve damage. Now, tip, pearls in the vitamins. If you talk about peripheral neuropathy, I want you to answer B6 or pyridoxine. Okay? There is a specific nerve condition associated with vitamin B5 or pantothenic acid deficiency, and we call this nutritional melalgia. This is also known as burning foot syndrome. Okay, again, this is also known as burning foot syndrome. Now, vitamin B6, this is known as pyridoxine. B6 can also be in the form of pyridoxal. It can also be in the form of pyridoxamine. Now, very important function of B6 is it serves as a coenzyme for the transamination process as well as amino acid decarboxylation. I would memorize this by heart. Vitamin B6 plays a very important role in transamination as well as amino acid decarboxylation. Now, according to Harper's, B6 also plays a role in the modulation of steroid hormones. And isoniazid, which is an anti-tuberculosis medication, would inhibit the absorption of B6, thereby cause vitamin B6 deficiency. This is the reason why when we prescribe anti-TB meds that has isoniazid, we also give vitamin B complex. Now, B6 deficiency is also associated with peripheral neuropathy. It's also associated with seizures or convulsions, and it's also associated with disorders of amino acids. Why is it associated with disorders of amino acids? Because it serves as a coenzyme for transamination as well as decarboxylation of amino acids. Okay, now biotin serves as a coenzyme. It serves as a coenzyme for carboxylation reactions which occur in gluconeogenesis as well as fatty acid synthesis. Memorize the fatty acid synthesis. Now, tip. Biotin deficiency also presents with dermatitis. But if I were to bet all of my neurons and everything I have, basta dermatitis, memorize pellagra, memorize B3 deficiency. Now, highlighted in your book is a protein known as avidin. Avidin is a protein which is found in raw egg white. Avidin inhibits the absorption of biotin. Okay, now B9, folate. Please remember, this plays a very important role as a coenzyme in the transfer of one carbon groups or one carbon fragments. Does everyone still remember tetrahydrofolate? Okay, now what anti-cancer drug or what anti-neoplastic would inhibit the enzyme dihydrofolate reductase? What anti-neoplastic or anti-cancer drug would inhibit dihydrofolate reductase? What anti-cancer drug? This, of course, is methotrexate. Okay, methotrexate. Don't forget, methotrexate toxicity is reduced when we give the drug folinic acid. What is the other name of folinic acid? Folinic acid is also known as leucovorin. This is what we call the leucovorin rescue. This is also known as the leucovorin rescue. Now, two very important manifestations of folic acid deficiency. One is megaloblastic anemia. Don't forget, folic acid or folate is one of your hematopoietic vitamin. It plays a role in hematopoiesis along with vitamin B12. Folic acid deficiency during the first trimester of pregnancy is associated with neural tube defects, particularly spina bifida occulta, myelocele, and meningocele. So don't forget, These are the peripheral smears you see of megaloblastic anemia. You get neural tube defects or NTDs with folic acid deficiency. Just to name a few, spina bifida occulta, meningocele, and myelomeningocele. Okay, now vitamin B12 or cobalamin plays a very important role of the transfer of methyl groups. This is very important in nucleic acid synthesis. Now, don't forget this. Of all of your vitamin Bs, it is B12 that affects myelin formation. B12 deficiency is associated with a condition known as subacute combined degeneration. Subacute combined degeneration. This involves the spinal cord. Okay, subacute combined degeneration. This is B12 deficiency. Now, always remember the key pearls you have to bring with you to the boards. B12 requires intrinsic factor for its absorption. So vitamin B12 or cyanocobalamin is absorbed bound to intrinsic factor. If you remember, intrinsic factors produced by the parietal cells. The parietal cells are also known as the oxyntic cells. Function of the parietal or oxyntic cells is to produce hydrochloric acid as well as intrinsic factor. So deficiency of B12, this can produce pernicious anemia. We have autoimmune disorders of vitamin B12. We have autoimmune disorders which attacks the parietal cells, like for example, chronic atrophic gastritis type A. Okay, chronic atrophic gastritis type A. So just to remind you guys, chronic atrophic gastritis, this is very important because the gastric mucosa has the parietal cells. So in chronic atrophic gastritis, okay, you have three types. You have three types of chronic atrophic gastritis. Type A, my secret here is A, it's autoimmune. There's autoimmune destruction of the parietal cells. That's why you develop pernicious anemia. Type B is associated with B, bacteria. And what is that famous bacteria associated with gastritis? It's associated with duodenal ulcers, peptic ulcers. This is H. pylori. And lastly, we have the type C, chronic atrophic gastritis. Letter C for me stands for chemicals. Okay, this is your chemical type of gastritis. Okay, now, don't forget, vitamin B12 is strictly from meat sources. It only comes from meat sources. Therefore, who is prone to B12 deficiency? What particular diet is prone to B12 deficiency? Okay, what particular diet is prone to B12 deficiency? These are the strict vegetarians. Okay, strict vegetarians. Then we go to vitamin C. So you look at this picture, it's so bright. It's so very citrus, okay? Because one of the richest source of vitamin C is citrus fruits. Now, vitamin C, this is ascorbic acid, plays a very important role as a coenzyme in the hydroxylation of proline and lysine, thereby giving you hydroxyproline and hydroxylysine. This is very important in collagen synthesis. So don't forget, vitamin C is required for the cross-linking of your pro-collagen. The pro-collagen has to undergo cross-linking to become the active form of collagen. Therefore, vitamin C deficiency also leads to problems with collagen. So collagen type 1, this is associated with osteogenesis imperfecta. Okay, osteogenesis imperfecta. So this is brittle bone disease. Vitamin C is also an antioxidant, also plays a very important role in the absorption of iron. Vitamin C deficiency is known as scurvy. So they're going to present with loose teeth or loss of the dental cement. Okay. They also present with easy bruisability, gum bleeding, and subcutaneous hemorrhage. So this is the scurvy gums. And there's also problems with bone because type 1 collagen is bone. So this is the Frankel sign, not Frankenstein. Okay, that's the Frankel sign. Now, let's wind up with the minerals. This is going to take about 5 minutes. Kaya pa? Are you still with me? Are you still with me? Can you still survive another 5 to 8 minutes? Are you still with me? Hi, shout out to everyone viewing. Are you still with me? Let me know you're still with me. Let's see the chat box if you're still with me. What's your goal? Pass or fail? Pass, fail, or top? What is your goal? Choose from the 3. Pass, fail, or top. Which one would you like? Which one would you like? Pass, fail, or top? You can only choose one. Don't give me a maybe. Is it pass, fail, or top? What would you like? Pass, fail, or top? Not top, tapot. Okay, what would you like? Pass, fail, or top? Come on, be with me. Okay, pass. That's good. Okay, pass with multiple S's. Okay, top, yan. That's what we want. Okay, we fall short, at least you pass. Okay, so Kaya, last 5-minute stretch. Let's begin. Now, your minerals are divided into macro or micro minerals. The macro minerals are the major minerals. The magic number is 100 milligrams per day. That is macro. Less than 100, that is micro minerals. So these are your macro minerals, just to enumerate: calcium, sodium, potassium, chloride, phosphorus, magnesium, and sulfur. For the micro minerals, this is what we also call the trace elements. Okay. Required intake is less than 100 milligrams per day. These are the essential trace elements: iron, manganese, molybdenum, iodine, zinc, copper, cobalt, fluoride, selenium, and chromium. Now, which is easier to memorize? Is it the trace elements or the macro minerals? Which is easier to memorize? I would probably say the macro minerals are easier to memorize, but tip, what usually comes out in exams is the trace elements, because deficiency is more common with the trace elements, particularly iodine. Iron deficiency, that's the most common mineral deficiency worldwide. In the recent boards, chromium came out, selenium, zinc, and copper. Okay? So it will be your responsibility to memorize the RDA, the recommended daily allowance. Now, calcium, this is the most abundant mineral in the body. 99% of calcium is found in the bones and the teeth. 99% of calcium is found in the bones and the teeth, and that is in the form of skeletal calcium. So what hormone plays a very important role in calcium metabolism? We have parathyroid hormone. We have calcitonin. Okay, parathyroid hormone and calcitonin plays a very important role. Okay, very, very important role in calcium metabolism. Now, the functions of calcium. So 1, bone and teeth maintenance, transport function of membranes. We also have the transmission of ions across membranes. Now, calcium is very important for neurotransmitters. You have to remember, in basic nerve physiology, the release of neurotransmitters from their vesicles requires the presence of calcium. Nerve transmission, regulation of the heartbeat, the clotting process. I'm not sure if you remember that the extrinsic and intrinsic pathway, as they merge in the final common pathway, okay, that's factor 10. Factor 10 is activated, but it needs the presence of calcium. Now, next is phosphorus. 80% of phosphorus is in the form of calcium phosphate. This is also found in the bones and the teeth. Regulation of phosphorus is maintained by the parathyroid hormone. It is maintained by the parathyroid hormone. That is for phosphorus. Then we have sodium chloride and potassium, which plays a very important role in electrolyte balance, water balance, and maintenance of osmotic equilibrium. Now, very important are your famous sodium, potassium, ATPase pump. Then we also have the sodium, potassium, hydrogen ATPase pump. This is very important for the production of hydrochloric acid. This is what we call the proton pump. Hydrochloric acid production. This is what we call the proton pump. Okay. Then we have magnesium, which plays a very important role in nerve excitability as well as relaxation of the muscles. Okay, magnesium plays a very important role in muscle relaxation and nerve excitability. Iron, okay, very important role for hemoglobin, heme synthesis. Okay, hemoglobin synthesis. Iron, okay, the body contains about 3 to 5 grams of iron, and 30 to 40% is in the storage form. Now, can anyone tell me what is the storage form of iron? What is the storage form of iron? Okay, again, what is the storage form of iron? Okay, what is the storage form of iron? So the storage form of iron is ferritin. What is the transport form of iron? What is the transport form of iron? It is transferrin. Storage is ferritin. Storage form is ferritin. The transport form is transferrin. Now, functions of iron, of course, is oxygen transport. That is through hemoglobin. And don't forget, iron plays a very important constituent part of your cytochrome system. Iron is very important for cognitive performance, as well as it's a backbone of your immune system. Copper, on the other hand, is transported in the serum by ceruloplasmin. This is the transport form of copper. Now, ceruloplasmin is usually associated with Wilson's disease. So diseases of copper metabolism is either Wilson's disease or Menkes disease. Now, which of these two diseases presents with the kinky hair? Which of these presents with the kinky hair? Is it Wilson's or is it Menkes disease? Is it Wilson's or Menke? So don't forget, kinky hair is Menkes disease or Menke. So don't forget, Menke, your hair is so kenke. Okay, so please remember that. Now, winding up, copper plays a very important role in the cross-linking of collagen. What also plays an important role in the cross-linking of collagen? What vitamin? Are you still with me? What vitamin plays a very important role in the cross-linking of collagen? It is vitamin C or ascorbic acid. So collagen is the big C. Collagen requires copper. It also requires vitamin C. So please remember that. Copper also plays a very important role in the synthesis of melanin as well as catecholamines. Now, since we are in biochemistry, what amino acid gives rise or serves as the precursor for melanin and the catecholamines such as norepinephrine, dopamine, and epinephrine? What amino acid plays an important role and serves as the precursor for melanin and catecholamines? What amino acid? What's the amino acid precursor of norepinephrine, epinephrine, as well as dopamine? It is tyrosine. And would anyone happen to remember what is the precursor of tyrosine? So don't forget that tyrosine is also the precursor of the thyroid hormone. So what is the precursor of tyrosine? Tyrosine, the precursor is phenylalanine. So please remember that. Now, let's wind up with the last slides. Cobalt. Most of the cobalt is found in vitamin B12. Remember, cyanocobalamin. So cobalt is a component of cyanocobalamin, and it plays a very important role in the maturation of the RBC. It plays a very important role in the maturation of the RBC. So lastly, we have zinc. Plays a very important role in wound healing, plays also a very important role in bone metabolism. Zinc also plays a very important role in the degradation as well as the synthesis of carbohydrates, proteins, and fats. It plays a very important role as a transport protein as well as immune function. Now, this is what came out in the board exam. Carbonic anhydrase. Okay, I hope everyone still remembers carbonic anhydrase in the RBC. So the formation of carbonic acid, H2CO3, sorry about that, H2CO3, which of course will yield bicarbonate. What is the cofactor of this enzyme, carbonic anhydrase? It is zinc. Okay, zinc is the precursor, not the precursor, but the cofactor of carbonic anhydrase. So let's end with this principle and this disease. Okay, this is a genetic metabolic disorder of the uptake of zinc. Okay, this presents as a triad of dermatitis, alopecia, and diarrhea, similar to dermatitis of niacin. However, this is zinc deficiency. Okay, this condition is known as acrodermatitis enteropathica. Okay, acrodermatitis enteropathica. This is congenital zinc deficiency. So we're going to end with this photo. This is a classic picture of acrodermatitis enteropathica. So this ends our quick biochemistry blitz coaching with your med guru, Doc Toom. Thank you very much for listening. You want a copy of this presentation? I'll upload it here in this. I'll upload it in the comment section. Okay. Taas kamay, raise your hand if you want a copy. Okay, of the presentation. I'll give you a PDF. Okay, a printable PDF. Okay. Would you like a copy? Tap the like button. Tap the like. Okay. Tap the like and just type below. So thank you very much for listening. I hope in one way or the other, we gave you a better appreciation and understanding of biochemistry. God bless everyone. This is Doc Toom saying daghang salamat.